Hi, I'm Maddie Bills.
I'm Caroline Byrne.
And I'm Abby Elkin.
And our research topic that we decided to cover was active lifestyles in nurses and the benefits that they can have because of it. Our problem statement: practicing nurses are unable to get enough exercise or meaningful movement due to lack of time throughout their days, which is increasing the risk of health, weight, and mental issues. As nursing students, we discussed how we struggle to find time to exercise and wondered if this was an issue in active nurses. To none of our surprise, this is an issue in licensed nurses, and the effects are shocking. Nurses are facing an increased risk of health, weight, and mental issues due to their lack of time to partake in physical activity. Throughout our research, we have found a variety of sources that have helped prove that the lack of exercise in nurses is a prevalent issue. According to an article by Connie researching risk factors of cardiovascular disease in nurses, the leading cause is the lack of exercise and sedentary lifestyles. In another article looking into unhealthy lifestyles in nursing, they explored obstacles that nurses reported when it came to making time for exercise. The top reports for these barriers were being overworked, undereating, studies and academic obligations, and the lack of social support. Because of these barriers, 30% of nurses in the study were reported to be overweight, and another 17 to 25% were reported as obese. Interventions that we have looked into throughout our research have been how the promotion of exercise has affected nurses' health, overall feeling, and efficiency in their work. We started by looking into a study that evaluated the correlation between an increase in nurses involved in physical activity counseling and patient satisfaction of nursing care. These researchers found that the NPAC is positively associated with care quality, patient satisfaction, and loyalty, which suggests that the incorporation of PA counseling in clinical nursing can meet patients' quality expectations and encourage long-term utilization. In another article we looked at, researchers looked into nursing that met a step count of 5,000 steps in a day. In this population, they evaluated how these active nurses were affected by anxiety, depression, and poor quality of sleep. Results displayed a negative association between physical activity, low to moderate as well as to high to very high in depression, and no significant associations between physical activity and anxiety or quality of sleep, according to Hussender in 2022. There are a variety of negative impacts that can occur if no interventions are done to improve the physical activity levels of nurses. As we all know, burnout is a large issue hitting the nursing field today, and researchers have come to discover that one of the biggest reasons for this burnout is the lack of time for personal care like physical activity in nurses, according to Worth in 2023. An entire separate study found a very similar conclusion. 53 to 61% of nurses in the study reported poor diets, and 60 to 74% reported participating in inadequate levels of physical activity, according to Ross in 2019. Because of this, nurses are at a substantially increased risk of developing chronic diseases, which can later lead to absenteeism and more frequent turnovers. Our evidence-based practice intervention is to have nurses meet the American Heart Association recommendation for an active lifestyle. The American Heart Association's recommendation for an active lifestyle is getting an average of 150 minutes of moderate to intense exercise a week, according to the American Heart Association in 2024. Our projected outcome for this intervention are a healthier nursing population, not only physically, but mentally and emotionally as well. We also predict that there will be less burnout or mistakes because the allotted time the nurses get to take care of themselves and their bodies. Our thesis statement is that the nursing employers need to provide physical activity counseling for their employed nursing population. Based on the data collected, one of the biggest risk factors that impact nursing care is the lack of time for self-care and exercise. The quality of not only nursing lives, but their level of care will increase substantially with the use of some type of physical activity counseling. The database that we used to find our sources was UARC Library. We had a variety of search terms and total yielded articles per search, and they were as follows: lack of physical activity in nurses and cardiovascular health for 138 articles, lack of physical health in nurses and the consequences for 76 articles, physical activity and healthy guidelines for around 7,000 articles, physical activity and connection to mental health for around 1,000 articles, and lastly, nurse exercise and qualitative for around 6,000 articles. The inclusion and selection criteria we used to select our resources was the population involved, the year it was published, if it was peer-reviewed, and if it pertained to exercise and overall health. Our exclusion criteria included articles that weren't studying the nursing population, articles dated earlier than 2022, lack of peer review or reliable sourcing, and the lack of relatability to our overall driving question.
We ended up with the articles that we ended up with because they best explained our overall problem, effects of that problem, possible solutions, effects of those solutions, and issues that will continue if a solution isn't industrialized throughout the healthcare industry. In a global systemic review and meta-analysis, Connie S. in 2024 searched 4 main databases including Scopus, PubMed, Embase, and Web of Sciences from the beginning of 2000 to March of 2022 with inclusive and exclusive factors included using the Newcastle-Ottawa scale. They narrowed down to 22 articles including 922,000 nurses to find that inadequate exercise with a prevalence of 46.3% is the #1 risk factor for cardiovascular disease in nurses, all due to a study by Connie in 2024. In a cross-sectional design with sensitivity analysis, ASMAIA in 2022 studied a population of 605 patients in an outpatient department. They selected their participants based off of a variety of requirements and standards for their study and were researching the question of how the impact affects the patient satisfaction over their care and the nurse's quality of care. Overall, this study found that a higher NPAC had a positive effect on patient satisfaction of care and the quality of nursing care, based on the study by ASMAIA in 2022. In a systematic review by Dugois and Acqua in 2022, it studied the physical activity in nurse trainees ages 18 to 25 with 16 participants in order to understand activity, barriers, and emotions towards physical activity. These participants were organized and selected based off of their willingness to participate and then further organized into groups based off of their BNI and other measurements. This study found that there is a very broad reasoning behind inadequate health in nurses. Some of the most prevalent include the lack of dietary knowledge, social support, and studies and lectures, all referenced by this study in 2022. A systematic review done by Husenoder in 2022 looked into a relationship between step count and mental health. With a sample size of 1,451 participants, they measured the effects of step count using Sensor Pro 3 upon depression, anxiety, and quality of sleep. This study found that there was a negative association to high activity level and depression and no significant relationships between step count and anxiety as well as quality of sleep. In a qualitative study done by Worth in 2023, researchers studied the question of factors that influence health-promoting self-care in registered nurses. With a sample size of 264 nurses from 27 different centers, they had nurses answer 3 open-ended questions regarding barriers to physical activity. Similarly to the other article, they found that many of the boundaries included a lack of time, work and family demands, as well as fatigue. These barriers come from issues like working long hours, shortages of affordable healthy foods, and lack of motivation to exercise, all referenced by this study by Worth in 2023. In a qualitative study performed by Walters in 2024, researchers performed a study questioning nurses' inability to properly exercise. At a facility, all nurses working were sent an email of a questionnaire that asked them personal questions about their activity levels, their thoughts on it, and any difficulties they had in participating in regular exercise. The study had 349 participants and found that the 2 leading causes of lack of exercise in nursing careers was being overworked and the lack of sleep or energy to work out post-shift. This study also reported that only a third of the participants felt like their fellow coworkers were supportive of them trying to partake in a healthier lifestyle, all referenced by Walters in 2024. This study was further examined by Ross in 2019. Based on these findings, it is evident that a change is needed in the healthcare industry. We as nurses chose to dedicate our life's work to saving the lives of others, proving for patients all levels of health that are needed to help them live out the best quality of their lives. However, if we aren't given ample time to take care of ourselves, how can we be expected to properly take care of others? Everyone knows that the turnover rates in the medical field, especially nursing, are increasing more and more. As we've come to prove throughout our research thus far, one of the top reasons is lack of time for self-care and adequate living as a full-time nurse. Nurses are malnourished, overworked, and simply tired. For a better medical industry, even as a whole, some type of healthy lifestyle implementation needs to be upheld. Understanding that healthcare workers are human too and not robots is an understanding that most cannot grasp, and that must change. Implementation of limited hours of work, dietary and exercise therapies, and healthier food options at hospitals is a great start at putting the health back into healthcare workers so that they can properly treat their patients. When going to the hospital, we as patients are likely facing one of our worst days. We expect fast care and to be the number one priority and forget that the hospital does in fact have other patients that can be in even more critical care than we are. As a society outside of healthcare, there's a huge perception that nurses are on a 24-hour, 10-to-me clock, which isn't true. Actions need to be taken to help society realize that the healthcare team is doing their best with the time and resources they have, which leads us to our next point. Nursing or any other healthcare profession is not just a profession we want to be rushed, overwhelmed, and stressed while doing. While a patient's life is in our hands, it is required that each task has our undivided attention. Nurses need time to take care of themselves in order to decrease the amount of medical mistakes being made due to simply fatigue and distraction and lack of exercise.
Finally, we can move on to our proposal. Our group's proposal is that the quality of not only nurses' lives, but their level of care will increase substantially with the use of some type of physical activity counseling. Nurse employers need to provide physical activity counseling for their employed nursing population. Based on the data collected, one of the largest reasons the quality of care from nurses is decreasing is due to their lack of time for self-care and exercise. With the implementation of this counseling, the lives of nurses and patients will improve substantially. Now we will move into our PDSA plan for this research project. Starting off with our overall plan. Our SMART goal for this project is that there will be a 20% increase in nurses who exercise 30 minutes 5 days a week by the end of 10 PDSA cycles. Their activity will be measured by a workplace fitness app that provides accountability and incentive. The outcome measures that we will use is the time of exercise, number of minutes exercise per week, and that nurses will see improved mental health post-activity based off a survey at the end of the tracker app. Our stakeholders will be nurses and their role in advocating and exhibiting patient care, and company employees with their role in providing accountability and incentive to exercise through the app. Without proper incentive from coworkers, the likelihood of this research going anywhere is slim, so this is vital. Continuing in our plan next is our process measures, which is as follows. First, app accessibility. We would manage this process measure by ensuring that the app is accessible to all nurses and is required for download. Secondly, incentive of participants to actually perform the exercises. To confront this process measure, we would make sure the fitness app has reminders to remind the nurses of the 30 minutes a day, 5 days a week reminder in order to meet the American Heart Association 150 minutes of exercise that is recommended. Next is the willingness of the nurses to participate. To help with this, we would set it up where nurses are given incentive by their supervisors to pursue physical activity. Lastly, accessibility of nurses to Apple Watches. To help not make Apple Watches a necessity to participate, we would create an app in order to upload pictures of proof and have motion sensors incorporated into the app, similar to an Apple Watch, to know when the participant is exercising. Following this, 2 balancing measures that we will watch and consider are sacrifice of time that nurses will face by participating in exercise on an already crammed schedule, and the possible increase in hunger that participants would face with their increase in exercise. If a participant is off that day, this isn't really a problem. However, if they were working, it could be. For data collection, activity is subjective to nurses and their own reporting. The data will be tracked pre-intervention through a survey the nurses will take upon downloading the fitness tracking app. Post-intervention, the data will be tracked through numerical methods like weight and time, and will be recorded on the fitness app. We will know our intervention is being utilized because the app will connect to a fitness device such as a watch that tracks heart rate in order to confirm the activity of the nurses. Our sources used for data collection include subjective studies to analyze mental health. Furthermore, watches or time will be used to track the nurse's time exercising. The parameters for our sample size is that you have to be a nurse or a registered RN. The data will be collected automatically through an online mobile app. Data will be protected through a privacy setting the nurse can control, and it will be regulated through an account creation that makes data only viewable to the direct user. The app will help the activity data remain confidential unless the nurse gives the right to share it. The budget for this project is subjective to the hospital implementing the nurse activity program and the incentive that they choose to provide. The timeline of this is whenever possible. We will arrange our data after the cycling of 10 PDSA cycles and estimate each cycle to be about 1 month long. We want to implement this as soon as possible because it is imperative that the nurses take care of their own physical health just as much as they take care of their patients. The initial scale of this project is hospital-based, and it will span from hospital to hospital. The scope is specifically nurses, and over time, nurses' physical activity will increase, and the result, their mental health, physical health, and patient care will improve dramatically. Our data will be analyzed through the app by the charge nurse or nurse supervisor to oversee the health of their employees. The app will also be used to present the data on a digital platform and gain insight on nurses' physical activity. We hope to see nurses engaging in activity in order to meet the AHA recommendation of 150 minutes per week. As a result, we hope to learn that nurses' mental health is improving alongside their physical health. If the data shows our cycle was successful, we can implement it across more hospitals and to other medical professionals. If it is not successful, we would change the entire project and maybe resort to more educational strategies to influence nurses to exercise. Our data can be used for additional learning by furthering in a patient component and finding correlation between nurses who exercise more and the care they perform. We plan on sharing this data with the medical field, especially nurses and exercise science fields. We would share these particular groups to encourage nurses to live a healthy lifestyle. This overall concludes our research project.
Thank you.